Director of the Angelou Center for Health Equity, and we want to welcome you to this very important webinar today, Black Lives Matter, Implications for Health Equity. We are certainly delighted that about our illustrious panel today, and also Dr. Allison Mathews, who has brought this together for us today. This is such a very important topic, and so we're delighted. We know there are many of you out there in the listening world this afternoon, and Allison is going to share with you also that you can listen to this later if you like, or if others are out there that you would like to share this with. The purpose of this event is to just begin this conversation about the current calls by Black Lives Matter activists. And we have such a wonderful panel today. We're very proud and excited about our panel. And again, this just begins our conversation in the Maya Angelou Center. I want to thank Dr. Julie Freischlag, who is on the call today, who is our Dean and CEO, who has begun this task force to look at many of these issues here at Wake Forest School of Medicine. So we're delighted that this is just one piece of what we will be doing. You'll be hearing from us more, so stay tuned. I'm going to turn this over to Allison because we have much to talk about. Dr. Mathews.
So much, Dr. Bird. I want to thank you all for joining, especially thanking the panelists. Each one of these powerful speakers have agreed to join us because they've had a great bit of involvement in shaping our criminal justice system and transforming it. And so we want to introduce Mr. Jeremy Collins, who's the director of the Office of Public Engagement in the North Carolina office of Governor Roy Cooper. We also have on the panel Dr. Jack Monell, who is an associate professor and program director of justice studies at Winston-Salem State University. We have Judge Denise Hartsfield, who is the judge of North Carolina 21st Judicial District. Ms. Deatra Jackson, who is a national director of BYP 100, which is a Black Youth Project, and she's a founding member of the chapter in Durham. Dr. Elimarie Caballero Quinones, who is an assistant professor in pediatrics and gastroenterology at Wake Forest School of Medicine, and has a background in mental health and psychotherapy. And Mr. William Penn, who is assistant chief of police for Winston-Salem in North Carolina. And introducing myself, I am Dr. Allison Mathews. I'm the Associate Director of Integrating Special Populations in the Maya Angelou Center for Health Equity at Wake Forest Baptist Health. So thank you all for joining. So today the goal is for us to hear a little bit about what each one of the panelists have been working on, some of the major kind of initiatives, and for them to introduce themselves. So we'll give 5 minutes, 3 to 5 minutes for each one of those, and then we will open it up for conversation. The Maya Angelou Center for Health Equity is in the spirit and the legacy of Dr. Maya Angelou. We're very interested in exploring how the criminal justice system affects the health of young Black and Latinx people. The purpose of this event is to have a conversation about the current calls by Black Lives Matter activists to defund the police. And as a health equity research center, we are particularly interested in exploring the impact of race relations and violence on health equity, particularly the implications that this might have on our community mental health and public safety. So we will start with an introduction or comments by Mr. Jeremy Collins.
Thank you, Dr. Mathews. Thanks for allowing me to be a part of this conversation. And just first, as a matter of course, on behalf of the 75th Governor of the state of North Carolina, Governor Roy Cooper, I want to thank the Maya Angelou Center and all of your partners for the work that you're doing to slow the spread and flatten the curve, COVID, and also the intersectional work of fighting back what we know is racism, racial oppression, white supremacy, and all the other social ills that create disproportionate impacts for minority communities, marginalized communities, and communities of color. Thank you for allowing me to be a part of this conversation. My name is Jeremy Collins. I'm from Eastern North Carolina, from a little place called Darden's, which is in Martin County, and have been working with Governor Cooper as his engagement director for the past 2 years. in my role, I serve as a connection space between the governor's office and community leaders across the state. We carry the governor's message of healthier North Carolina, better educated North Carolina, a wealthier North Carolina where people are able to live out more purposeful and abundant lives. We know that critical to that is a society free of racism, free of oppression, free of disparities. And that number one thing that both prohibits us from finding wealth and also living healthier is health disparities. The numbers don't lie. We don't need to study it. We know where we are. The question is, how do we take all deliberate speed and effort to get us from where we are to where we need to be? I'm extremely excited about being a part of this conversation. Our office has been engaged in community building, community power building work with every level of kind of marginalized population, also communities that are experiencing violence, economic depression, natural disaster, man-made disaster, pandemics that both come from within and without. And so I'm really excited about this. I'm excited about moving the needle forward. I'm also excited to be sitting alongside the esteemed panel and colleagues and just really looking forward to a robust conversation and some action. Everything that we do now has to be actionable. Our metrics have to be front and center. And when we look at the outcomes, if it's not moving people of color forward, then it is, in fact, moving us all backwards. So I'm excited about this space, looking forward to the conversation, and also inviting all of you to kind of engage with us in the Office of Public Engagement if there are ways that we can partner with you as an individual or your community groups towards anti-racism and ending white supremacy and advancing this one North Carolina community. So thank you.
Thank you, Mr. Collins. Next, we will have some words from Dr. Jack Monell.
Good afternoon, everyone. First and foremost, thank you, Dr. Mathews, for the invitation and the Maya Angelou Center. I'm always humbled to be able to engage with some powerful voices as it pertains to trying to find solutions and discuss some of the issues that we have faced in our community and our society. I'm a professor of justice studies at Winston-Salem State University here in Winston-Salem, North Carolina. Go Rams! And much of my research and focus for the last few years or so have dealt with Black masculinity, hegemonic masculinity, and particularly as it's translated and perpetuated in popular culture. Basically, how people view us, and more importantly, how it involves police encounters with Black males. So much of my work to date delves into that. I do a lot of other work as it pertains to Black males, Latinx males, gang work, juvenile delinquency, criminologist, social worker by training, and an activist. And I'm just always willing to engage with folks to try to address some of these historical, systemic, institutional, racially driven boundaries and barriers that we face as a society. And however uncomfortable it makes people feel, we need to ensure that we control that narrative. Thank you.
My name is Denise Hartsfield. I'm a Clackamas County District Court judge. I want to thank Dr. Allison for this opportunity to come and talk about what I do and have been doing for a very, very long time. I've been on the bench for 18 years in Forsyth County. But I've spent a majority of my career working in the juvenile justice system. So it's from that point of view that I have formed many opinions and have come to understand this whole issue a lot better. I'm also the pro bono coordinator for the pro bono clinic at Wake Forest University School of Law. And from my view on the bench, I have been able to formulate a number of programs with law students with this community. An expungement program, a Know Your Rights program, some health initiatives that have been begun in that arena. So I am very happy to be a part of this conversation. I want to start by saying that most recently I have been the convener of a School Justice Partnership Act, which is an act that talks about policing in the school and the prison school to prison pipeline. So I am aware of what needs to be done and have seen what I have seen from the bench, particularly from a juvenile perspective. And as I have been trying to work on some projects with the School Justice Partnership Act, I know how important it is to have public health at the table. I understand how many of the things that we are faced with that seem as though they have started from a criminal perspective aren't really where they started from. For years, for about 6 years, I had a juvenile drug treatment court. I ran that court through an institution that was out of Washington State. And in that drug treatment court, there were many kids who were smoking marijuana every day, 3 or 4 times a day. And at the end, I realized that we were missing a big part of the puzzle. Yeah, it was substance abuse, and yeah, there needed to be substance abuse education. Where a lot of these kids were self-medicated because they had underlying issues that had to do with internal medicine and other issues that nobody ever addressed. And why was this? Money. And money was the object on both sides of the fence. For kids who had parents who were working and were able to get private insurance, and for kids who had Medicaid. For the students who had parents who had insurance, they could not get Medicaid, and their private insurance wouldn't pay for the things they needed for substance abuse. Consequently, other parents couldn't get Medicaid, and they couldn't get Medicaid benefits or get signed up for those benefits and didn't know how. So public health is at the center to me of this conversation. That's why I was so enthusiastic about joining this conversation, because so often when we talk about reforming and reformation of the criminal justice system, we do not talk about public health. I remember Ferguson. I remember the fact that if the police had known their community better, if they had known the people who had mental health issues, if they had known the people in the community who had other kinds of issues, dual diagnosis kinds of issues, they would have known that this person needed some extra kind of help. And so it's that conversation that I would love to join in with these astute and esteemed people who are here. My point of view is from the juvenile justice system primarily, but I understand that in this reformation, they should be the first step in the process.
Hi, everybody. Thank you for having me. I'm really honored to be invited to this discussion. My name is Deatra Jackson. I use she, her pronouns, and I am the National Director of BYP 100. And BYP 100, which stands for Black Youth Project, is a national Black members-based organization of 18 to 35-year-old movement builders, creatives, artists, activists, and organizers that are fighting for Black liberation and freedom in our lifetime. And I am based in Durham, and a lot of my work and a lot of the work of the organization is in the realm of criminalization. So not just around policing, but also the ways that surveillance shows up in our communities and affects our well-being. The ways that criminalization. Y'all know what I'm trying to say because y'all are the experts. Criminalization of sex work and how that plays a role and damages our communities, but also the rise of police budgets and mass incarceration. So that's some of the work that we do in this organization. I am a local organizer with Durham Beyond Policing, which is a campaign to really push for divestment from policing and reinvestment into our communities. And one of the things that we've been able to do here in Durham is get a proposal approved for a community safety and wellness task force, a grouping of community members that are able to really respond to the different ways that our community needs help and support and resources that do not involve the police. And because we believe that the police do more harm than good. And so that's some of the work we're doing here in Durham, really pushing for more alternatives that are meant to prevent things happening in the community, not just responding to those. So I'm really glad to be here, excited to talk about what we're doing, and yeah, thank y'all for having me.
Thank you so much. And then Dr. Elimarie Caballero Quinones.
Hello. Thank you, Allison, for inviting me and for the opportunity to be here today in this powerful panel. I'm really excited with these conversations with all these experts. So I'm a psychologist, a clinical psychologist licensed in North Carolina. I'm originally from Puerto Rico. And I work right now at Wake Forest as a pediatric psychologist and an assistant professor in the Department of Pediatrics. And part of my role basically is work with integrated care and help kids and young adults and teenagers to manage and address their issues of mental health, but also the medical conditions, and try to address the issues that came with that of quality life and other issues related with that area. I'm also part of the Committee of Diversity and Inclusion in the Department of Pediatrics. We are working together on some initiatives to help and improve our services over there. And also, I'm a co-chair initiative as part of the Latin affinity group at Wake Forest. We are looking to improve our services for African American people and also for Hispanic people in our community, and try to see how we can do a better job, not just in the community, but also in the healthcare center. So thank you for having me here today. I'm really excited to be part of this conversation.
Thank you. And then last but not least, we have Assistant Chief of Police, Mr. William Penn.
Thank you, Dr. Mathews, for allowing me to participate in such an important discussion. My name is William Penn. I'm a 22-year veteran of the Winston-Salem Police Department, also a lifelong resident of Winston-Salem. I oversee a bureau that deals with the recruitment, the training of our officers, as well as some of the other support services bureau, which is communications, records, basically all of the folks you don't see out on the street on a day-to-day basis. I'm excited about being here, excited about this discussion, being open in the discussion, and talking about how a culmination of social issues come together that really makes things difficult for our people. And I'll finally end with, I got my graduate degree from Winston-Salem State. So again, you've heard it before, but go Rams.
Thank you. So I want to move into our first discussion question. So in your impression, what changes, I'm going to just, start with like the big question, right? What changes do you think are needed for us to have an effect on health equity for Black and Latinx young people?
I think that question is a very deep and important question, but probably going to have many answers. And it depends on the perspective that we are seeing that question, right? And I would just point out a little bit of context. When we talk about what changes are needed and what we need in the society, right, to address this with Black and Latinx communities, we have to think about what has been happening in all these years. And I was looking for information, and it's so interesting to see that since 1985, the government knows that racial and ethnic disparities exist among minority people, including African American, Hispanic, Native American, Asian people. And we are still in 2020, after 35 years, fighting and, working so hard to continue letting them know and the needs that we have in the community. So to me, it's very important that we address the social impact of the situations that are happening in the society. We need to understand that it's a systemic root cause of the health inequities in the United States. We cannot see this as is an individual issue. This is a systemic issue, and we have to address this from all the levels and try to do changes that address the poverty. How we gonna reduce poverty, address laws, how we gonna fix and change policy, public policy, how we gonna work with public health, how we gonna transform healthcare delivery or healthcare centers, how we gonna manage and restructure all these big agencies that perpetrate for years racism and discrimination against Black and Latinx communities. So I think we have to identify what are the social, economic, and environmental impact of this need and see how we can get together and continue doing changes in this area. I think it is so important to create programs or to fund those programs that already exist in our communities and do not have enough money to really work or address all the issues. For example, places that promote arts and talents in our kids, better education programs. I think we're lacking a lot of education every time that we have an issue. The first funds that cut is for art or social activities, or volunteer or mentoring. That is the first funds that usually the people cut when they need to do big cuts. And that is one of the stuff that will help with mental health. Because how are you going to have better mental health when you don't have, the needs for this population in the community? We have to work together to increase, the opportunities for these young kids to have other activities like better employment, when, opportunities for employment, opportunities for education, green areas. This community also even don't have green areas sometimes. And that just can help us to improve our mental health. So I think it's a lot of work that we have to do, but it is important to target all these social and economic aspects that are going to help us to kind of improve our services and also improve the health equity for Black and Latinx communities.
I want to start by saying that I think it's accessibility, location, education are key to this answer. But I'd first like to start with an analogy that I often make. And I think that this is going to show just how important it is for us to understand other cultures and where people are coming from. I often say that people use the emergency room and the courthouse differently. We find that poor people who are economically disadvantaged, who don't have a personal information, if they get sick, they go to the emergency room, and the emergency room becomes their doctor. The exorbitant fees for riding in an ambulance and doing all those things. So it is in the criminal justice system. People who do not have a lawyer, I'm going to call my lawyer. That's what affluent people say. That's what people who are connected say. But if you don't have a lawyer to call, then you find yourself in court for all kinds of things, unrepresented, and only being able to luckily get a judge who will hear you and let you have your day in court. And so it is with the disparities in health equity. I know that a lot of times I have tried to get people to go and look at their public health, their mental health, substance abuse, and other kinds of things. But at the end of the day, they won't go because they're afraid of deportation sometimes. Sometimes they're afraid that somebody's going to just reject them because they don't have the financial means to come, or because they know that they're sick and really don't want to find out. So in all of these systems, and particularly in the criminal justice system, I think there are a myriad of ways that we can incorporate this picture into things. For example, probation. As a condition of probation, which I think needs to be structured totally, but as a condition of probation, there can be a mandate that you have to have certain things in mental health, in emotional health, in physical health that you have to complete during your period of probation, or else you won't comply. We see probationary sentences as punishment sometimes, but a lot of times judges are able to send people and allow people to do different kinds of things that can assist them rather than harm them, even though it's mandated and means that you have to do it with a consequence. I also think that we need more one-stop kinds of facilities that deal with not only the things that the doctor deals with, but have somebody there who can deal with some psychological things. Have someone there who can deal with, some daycare kind of issues. More one-stop things are needed. in our community. We need, in the east part of town, we clearly need more locations where people can go. Yesterday, I went to the CVS in East Winston, and they have, a drive-through for COVID. It was packed. I mean, there were 50 cars in that line. I think that there are a few others now, but we need, so people can have accessibility to these things rather than getting fed up and say, I'm not going to do it. So 3 points are accessibility, location, education, and one-stop kinds of facilities.
Definitely agree with Your Honor in reference to some of the accountability, but I think we're missing, kind of that elephant in the room in the discussion as it pertains to health inequities. Is the fact is that's done by design. So the reality of it is that when we look at, these specific communities that lack, adequate health resources, that's not done, in a vacuum. That's done purposeful. And what it means is when you look at these inequities from a health standpoint, they do translate to all the other aspects of our society. As a criminologist, we see the end result oftentimes of children and or adults who had unhealthy lifestyles growing up, poor nourishment. We talk about the judge talked about East Winston, food deserts, things of that nature. We talk about health insurance, and we talk about, whose health insurance is better than others. And we talk about the available resources and information provided to students in respective communities, particularly our African-American and Latino communities. And the reality of it is that, they are not no one is speaking for them in this regard. The expectation is you go to what's available, where they're advocates. So similar to the judge, more importantly, I need our legislators to ensure that these communities have equitable access to health resources, albeit in the form of clinics, albeit in the form of, kind of community educational areas or programs and things of that nature. And finally, we have to ensure that we are in the community. One thing I take a lot of pride in, as we're talking about my institution, WSSU, they have a mobile health unit that goes into the community and ensures that people have access to things. And that's critical as we look at how do we balance the scales. Mr. Collins talked about, addressing that curve, flattening that curve. Well, we have to work collaboratively. It's not the health department against the criminal justice system against the school system. We have to work collaboratively to ensure that these communities are represented and cared for.
I would echo what my friend Dr. Monell says and take it one step farther and say that not only is it done by design, Dr. King writes in his book, Why We Can't Wait, essentially that he believes that people who do bad use their time more constructively than people who do good. That time can only be used in two ways, either constructively or destructively. And so one is an acknowledgement that when we talk about disparities, we can't say communities of color experience disparities. We should change the language to say either by silence, either by omission or commission, we create these scenarios where communities of color are harmed and experience that harm by way of health disparities. And then we must kind of immediately pivot from that space to say, and this is where anti-racism comes in. This is where actively implementing racial equity comes in. There is no neutrality, as Dr. King would say. There is no neutral time. It's either constructive or it's destructive. So if we're not constructive, if we're not actively being anti-racist, if we're not actively working to provide health service to our most marginalized communities or to every North Carolinian, then we are using our time destructively. And the governor took action on this a few weeks ago by signing Executive Order 143, which essentially uses federal CARES Act dollars provided to the state to the sum of $11 million for COVID-19 testing and underlying service. And what that means is if you are a North Carolinian, if you are uninsured North Carolinian, and you suffer from any underlying condition of COVID-19, so that is hypertension, high blood pressure, pulmonary illness, diabetes, obesity, asthma, you can go to a free health clinic, a free health center, your local health department, and not just be tested for COVID, but also receive health care services for those underlying conditions that will be reimbursed through the Federal CARES Act dollars. But our time has to be spent with the delivery of service, not just the conversation about what's happening, because it really trivializes what's happened to continue kind of like, well, who's on first and which came first, the chicken or the egg. In reality, we have allowed this to happen. Even if we weren't actively holding it back, we weren't pushing a thing forward to push service in our communities. And the way to respond to that is to deliver the service as opposed to figuring out kind of how we reach people to tell them what the problem is.
I want to jump in here, and also just as a representative of Wake Forest Baptist Health, I think it's important for us to call to the mat, and this is with like leaders from Wake Forest Baptist Health on the call and representatives. I think we have to call our institutions to the mat and say, you know, the decisions that we're making or not making, or even the protocols that we have in place, we have to also be reflective on how those things are reinforcing inequality, and making sure that we have centers like the Maya Angelou Center and others and other institutions, other kind of leaders like the people on the panel who have a voice to be able, and also having community voices present at the decision-making during the process of making decisions, so that we're not replicating the inequality that we're actually trying to fight against.
I think for me, one thing that, especially being in a global pandemic, when it was first really coming to very visible light, whether it was on our feeds or on our TV, just like the numbers of people that are being affected, but also that Black people are disproportionately dying from the pandemic, and that isn't divorced from so many of the other health conditions that Black people are disproportionately dying, not only contracting, but actually dying from these different diseases. And there was just lots of critique of our healthcare system overall, of how unprepared our healthcare system, and how our healthcare system isn't ready, or wasn't ready. It isn't ready currently, right? We're still in the global pandemic. There is no second wave. It's just one wave that we've always been in. But that the reality is, like, our hospitals and our healthcare system is built for profit. It's not actually built for the wellness of people. It's not built for the caring of people, and especially Black people, especially brown people, especially people with pre-existing conditions and different abilities. That's not what our healthcare system is made for. It's really made for profits. And so when we really call to the mat, as you were saying, Allison, like, we need to make sure that we're talking about the ways that capitalism and profit shows up in systems that are meant to be of services to people. And that includes the healthcare system. It also includes our criminal justice system. And in my mind, we don't actually have a healthcare system. What we have is a capitalist system that is providing a process of deciding who gets access to health and who does not. And the same thing at the criminal justice system. We do not have a criminal justice system. We have a capitalist system that is providing a process of deciding who gets punished and who does not. And that is why we see these high numbers in these high rates of Black people and of poor people that are dying and being punished at disproportionate rates comparatively to where the population is, and comparatively to where white folks are. It is because capitalism and profit, these things are racialized, and they always have been. especially in the fabric of our company and of our country, and also here in the state of North Carolina.
It's the most important point is that racism and capitalism they go hand in hand. One reinforces the other. And so, when we're talking about reimagining a future or funding Black futures, and we're talking about, finding ways to eliminate, I guess, the inequality, we have to think about where the money goes, right? And that's a big part of why this call for defunding the police has even come into being, is because we're following the money trail. And, Obama even called out asking for city officials to be transparent in their budgets and to show decreases in the funding. You follow the money trail, and the money trail is not going to the services that everybody thinks are important. It's going to other things that are kind of reinforcing the inequality that we're trying to fight against. So I want to just move on to the next question. So what implications does policing and subsequently defunding the police have for our communities, in particular mental health and public safety?
Well, quite frankly, once again, when we hear this, there's been a lot of talk, discussions as it pertains to defunding the police, and quite frankly, the rationale behind it has to do what we've discussed thus far. Defunding police. We're not talking about disbanding or anything of that nature, but what we're talking about is reallocating these resources to social services programs, mental health programs, early interventive initiatives that bridge those relationships or attempt to bridge those relationships between community members and or respective police departments. Because the true reality of it is that police officers are not trained, unless they happen to be clinically trained, which, maybe they are, but arguably they were not trained in the academy to be social workers or clinicians or, mental health providers. That's just not their role. So oftentimes when they go to when they engage with individuals, depending on the respective jurisdiction, that interaction can go south very quickly, which we've seen most recently, but quite frankly, historically. This is not a new phenomenon. So for people who are watching, don't act like, listen, this is not a new phenomenon in our community. But the reality of it is when it's done right, it could work. Case in point, Dallas, Texas. They are requiring now that social workers or clinicians accompany police officers to mental health visits or mental health wellness checks. That makes more sense. It's no different than when social workers kind of do home checks when there's a report of abuse. And then more importantly, you look at Camden, New Jersey, where the new chief fired the entire department and started from scratch to ensure that his officers were more engaged with the community. It's a cultural mindset because the system was never created nor intended to benefit the African-American community, not at all. And because of that, externally, what you find is that you have more people suffering in the community, and it varies from education, from health inequities, from violence and everything else that we see. But the mental health piece is incredibly important, particularly in Black communities right now, because we're seeing a rise of suicides by younger people. And that's because they have no outlet. And I know we're talking about kind of mental health, but that's something that we got to continue to work on because of all the trauma that they continuously see on television and social media platforms.
I want to chime in with my dog on this one. I mean, essentially, you gotta my grandmama used to say, you can't spend money twice. And what we're doing when we're talking about defunding the police, again, so let me also just safely say, let me take my Governor Cooper hat off and let me put my Black man hat on. What we're not saying in this conversation is we've been overfunding the police for generations. We have militarized the police in Orange County with tanks and assault weapons. And literally when they come to our city councils and our county governments and say, we need more flak jackets, we need more tear gas, we need more assault rifles, we need all these things that are used, let's just keep it all the way real, that are used to keep our communities. Some, we say sometimes some communities are patrolled and other ones are controlled. All these tools are primarily used to control Black communities. So when we say defund the police, if the linguist in me and the social scientist in me and the lawyer in me wants to say, wait a second, let's make sure we have this conversation completely intact. And that is, stop overfunding the police. Stop giving them money to do things that harm our communities and reinvest those dollars into proven solutions. And because alone, it's the difference between talking about racial equity and anti-racism. If we just have a conversation about racial equity, it becomes transactional. But when we talk about anti-racism, it gives a foundation and a context for everything that we know to be true that helps all communities. We don't want to see the Black or brown community thrive to the peril of another community. What we're saying is we don't want to see other communities thrive to the peril of the Black community. And so I think I'm gonna put my Governor Cooper hat back on now and say we need to continue having full circle conversation about that, because we cannot deal with health disparities. I mean, we're in a river here. We're in a body of water. So we talk about the different projects. You can't go in with surgical precision and say we're going to deal with health disparities, but continue to allow disparity to happen in all these other spaces. We are in an intersectional space where our words have to be actionable and our actions have to be wholesome and full circle.
Can I just say, tad bit discouraged with the word defunding, particularly now, because when you look at the timing of the argument for defunding, it almost comes across as, hey, we're angry with the police, so let's take money from them and give to very worthwhile social programs. And see, those social programs needed to be funded 3 months ago, 6 months ago, a year ago, 2 years ago. And so to then say, we're going to take this money from the police now, give to folks who've been needing this money for years, I don't like the message that sends. With that said, I'm all about reallocation. And that is a discussion we should have. It's been touched upon. Absolutely. Police officers haven't been trained to deal with all the social issues that they're being called to. However, who else is there? As we've seen time and time again, it's part of our own doing, we have folks calling in on suspicious activity, which amounts to, hey, I'm going to use my racial bias and I'm going to get the police to do what I can't do for myself. So if we're talking about reallocation of resources and not just reallocation of funds, because I've seen money been thrown around all my career. Money's thrown in here. You get a fancy grant writer, you can get money for almost anything in our communities. But what happens when you just throw money at it? It's still doomed to fail. So I'm willing, and I'm saying I'm like I represent all law enforcement. But let's have the discussion on reallocation of resources, and also we still have to deal with law enforcement and how they're treating our people as well. So we don't want to run away from that because we're taking away responsibilities from police officers.
I want to jump in just.
I'm sorry. It's okay. Go ahead.
Okay. And then we'll go to Dr. Caballero Quinones. So 2 things. One is that grant writing takes a lot of work. So just as a grant writer, I mean, it's exhausting, and the majority of the time you get rejected. There's only, with any grant, you may only get 5% acceptance rate. And so we're spending all this time submitting for grant money and not getting funded. And so there's this conversation also about, a purposeful funding of certain programs that don't have to really work for it. And not saying that police don't do work, and I mean, of course they do, but there are certain programs that, and one of the participants even made the point that there was $500,000 increase in funding for the police And there's only a certain pot of money that taxpayers should have a say in how that money is spent. And if it's being spent on things that are not benefiting them and are putting people in a vulnerable position, then that needs to be revisited and really talked about. Okay, I'm gonna leave it there.
I think I cannot agree more with what all my colleagues has just said. I think we have to change the narrative of defunding the police. And because when we first think about defunding, the first thing that came to our minds is, oh my God, we don't gonna have police anymore, or the police don't gonna have any money. So I think it's so important to change our narrative to really address these issues. And also, these conversations about funding is so important because we have so many programs out there that are not having funding and they need to close. They cannot serve the people that really need these programs. So New York State, $6 billion just in the police department. When you have other departments that do not have even a quarter of that money to serve the community, like housing, transportation, health, education. So we have to have this conversation about how we can provide not just to what is the police, but also all these programs that are going to help the police to don't be in the community assessing criminal activity or violence, because we are providing what the community needs to really decrease that. Sometimes we have kids that even don't have where to go. We have kids that don't have, social activities that help them to decrease criminal activity or to be out of the substance abuse issues. So I think we have to really think about what are the services that we need in the community and how we can help the police to really address those issues. Jack, I know you want to say something.
It's okay. No, but think about this, man. It's like, and first and foremost, let me acknowledge Deputy Chief, because he's my colleague and my boy. Go Rams. So he knows how much I care about him and care about the department. But secondly, it's a perfect, as we're talking about funding, it's an insult. I don't know if you guys caught it 2 weeks ago. I know Brother Collins did that. They just gave our North Carolina teachers a $350 bonus. What are they supposed to do with that in the scheme of education and preparing for classes? So we're talking about reallocating resources on the front end. Imagine how much work we can do on the front end through interventions and social programs, so that Deputy Chief and his folks and the Sheriff's Department and their folks don't have to hopefully engage with folks on the back end. And to me, that's just insulting that we have a debate about who's more important. The police are very important, but doggone it, I send my kids to school. I want them teachers to be top-notch, satisfied, and not overworked or overburdened. And I just think it's irresponsible in our society that we place more value on the militarization of policing as opposed to empowering and preparing our teachers to educate our children. Now, some communities, we know there are hotspot areas. We say that in high crime areas. We get that. But to Mr. Collins' point, you don't need tanks or grenade launchers in every district, in every community. I mean, who are you fighting? The Autobots or somebody? I mean, sheesh. I'm not the smartest guy in the panel, but it just doesn't make logical sense. I want our police officers to be well prepared to do their job and protected. I want them to go back home to their families. But equally, when I walk the streets of Winston-Salem or drive, I don't want to have to worry about an officer who might have some other issues going on and approach me in that manner. So we got to think about, when we talk about reallocation, it's just not taking money away to do whatever. It's really proactively trying to make our community better.
I want to piggyback on what this brother's saying, and this might seem scattered at first, but I'm going somewhere with this. We have the exact opposite narrative when we think about schools, and I'm bringing this up because Dr. Monell just talked about when he sends his kids to school. We have essentially defunded public education because we feel like it doesn't work. And we have reallocated resources towards private parochial schools and we call that choice. Now, I'm not making the argument that we should create some sort of private militaristic police force, but what I am arguing is that it is not a foreign concept for us to reallocate resources when we believe the system isn't working. But what happens when we talk about policing is, this a blue line, esprit de corps, let's cheer on the home team type mentality, where it's like, even if we have an inside conversation right now, it's like, you can't say nothing bad about certain things. You can't talk about so and so. You don't talk about the pastor. You don't talk about black leader in the community, because with that narrative, it's like it conjures up a certain kind of visceral response. And when an officer, all due respect to the deputy chief, when an officer says, I don't think that's what we need. Let's be even clearer about that. We have officers that say, you want to take funding away, we're going to walk away from the duty in your communities. Like that's not a fabricated thing, right? And so that sends a message to us, to folks in the Black and brown communities. We talked about this over militarization earlier. What's clear here, and this is the thing that we don't ever want to talk about. We've never addressed the police culture. All we address are police activities. And I'm not saying we as in our community, but as a state. The governor just signed Executive Order 145 to implement the Racial Equity and Criminal Justice Task Force. And it's going to deal specifically, brings together a task force that is chaired by Attorney General Josh Stein, Associate Justice Anita Earls, to deal with the culture of policing, excessive use of force, disproportionate excessive use of force, the criminal justice procedures that go all the way from investigations to incarceration, and the mass incarceration system. But the culture of policing comes from deputized white men who protected property from Blacks and Native Americans. We've never escaped that culture, but we talk about policing as it has professionalized and it has morphed into this state now. But if you look at the way communities are treated, I'll ask you to align it with the cultural narrative that I just gave you, and it makes perfect sense. And so even in this conversation where we're talking about defunding the police or reallocating resources, I mean, central to that conversation is unraveling the culture of policing. I'm a person who, as a Black man, who has experienced the following, the profiling. Just 2 days ago, while I was on the Capitol grounds and these monuments were being removed, I had a Black state highway patrolman who was protecting my life, who was in that space to make sure that no one harmed me. This is a nuanced conversation. This is a nuanced conversation, but we should be really clear that gone is the day where law enforcement gets to say, we don't like this narrative about defunding, because they've kind of proven over time that they don't know how to spend that dollar right. And I think that we got to be full-throated and have a lot of resolve in saying, we're going to help you spend the dollars that you have and reimagine what can be done with that dollar, because we can't continue to use state dollars to the peril of Black and brown communities.
So I appreciate this, but I do disagree on some of the points that folks have made. When there are young Black people that are out on the streets right now, that are protesting, demonstrating, and risking their lives, and constantly facing combat, like militarized combat by the police while protesting. And what we are calling for is for actual defunding of the police, not just a reallocation, and not a reimagining law enforcement, not any of that. We are actually, when we say defunding the police, that is actually what we mean. We mean a divestment, we mean a disarming, we mean a demilitarization, and we mean a delegitimization of the police. So just to be clear, I think one thing is that folks have already touched on is that the police have always had what they needed. They have always had what they needed and have always found a reason to need more, right? Whether it's more crime and the narrative of more crime and gangs and all these other things. A majority of the people that are sitting in the Durham County Jail right now are there for what we would call poverty crimes. There's no police training that can help people get out of poverty. And so, and the reaction and what the police are trained to do is enforce control, not to respond, not to help, not to support, but to enforce control. And many times throughout history, that control has came in the form of violence. In 2013, 2014. President Obama put out this new project for a task force to evaluate the police departments and create recommendations. And many of the recommendations are calling for more diversity. They're calling for better training, all of these things. That was in recent years. The same test, the same survey and research happened in 1967. And again, they call for the same things: more diversity, more training, and all of these things. But that's not what, and speaking of police culture, that's not what the police are made to do, not just trained, but that's not actually their role. Their role is to enforce control, and many times that control is in the realm of violence. And because the police system is ran by profit, it is racialized. So it's at the very bones of. It's not about a particular police department. It's not even about particular police officers. What it is about is that any police officer, whether they go to church, whether they're in a fraternity, whether they take care of their kids, whether they went to school, whether they've been trained, that any of them can murder me and anybody that looks like me in broad daylight on camera. With not only do they not get charged, but they don't even lose their jobs. There is no other job that is possible. There is no other role that is possible, because it's in the very fabric of what the police system has been made and has control to do. Also, that throughout the years, their role has expanded to responding to many calls, not noise complaints. They respond to when people's cars. They respond to that like all of traffic, when traffic is impeded, they respond to that. It's all these other things that have been laid on top of their quote unquote role. And again, the very fabric of the police state is to enforce control, and usually through violence. So that's why we have so much visibility and so many more stories that are being pushed to the front of police responding to someone calling them. And then that person ending up dead. That's why we have so many. Literally, police misconduct. If we were to look at the reports of police misconduct, the second most popular one is sexual assault. The third most popular one is domestic abuse. Like this, and again, that they're able to keep their jobs, let alone be charged. So it's in the very fabric of the police state, of the police system. And so when we say defunding the police, what we're actually saying is that there's some kind of way that states and governments always find a way to defund education. There's always a decrease in the amount and services to people that are experiencing houselessness. There's always less public housing. There's always these other things that people actually need that our elected officials or whoever's in charge finds a way to defunding. But some kind of way, when it's the police, it's, oh, I don't like the word defund. I'm not vibing with that. Maybe we should use a different word, but there's some way that we always defund education. We always defund other resources that people actually need. When we were launching our campaign in 2016, the Durham Beyond Policing campaign, we actually did a survey and surveyed over 500 residents in Durham and asked them, if you had $71 million, which is the amount of money that was spent on the brand new police headquarters that is here in Durham. But if you had $71 million to spend on your city, what would you spend it on? And nobody mentioned the police. Nobody said a police headquarters. People said mental health services. People said access to food. People said more low income housing. People named jobs. People named increasing the livable wage in our city. These are the things that people named because we know that they need them. And this is what our people would spend our money on. And it wasn't on a police headquarters.
Thank you so much for that. So there's been quite a few comments that I want to address or kind of bring up. There's no way they're going to go through all of the chat, but I think some of the interesting conversation that has come up been around. Well, one thing also is that, and not to derail the conversation, but again, back to this conversation about the connection between capitalism and racism, and this being a larger systematic issue. We're focusing on the police right now, but this really is also kind of talking about what's the issue with property taxes and overfunding certain schools versus underfunding other schools, right? Like what's the issue with where is the money trail going? And I think that should also be a part of this conversation, not just well, police, yes, because of the people are using it as a weapon against other people also, which goes back to Deidre's point. And then also somebody mentioned that there are services that help people kind of navigate the healthcare system and kind of get them connected into care. But again, those things are underfunded and they're also kind of patchwork for these larger issues that we're talking about. I'm looking at a question that says, is there a linkage between the judicial system to the local healthcare systems? Patient navigators can assist with getting the community members that need healthcare services linked and engaged in the healthcare system so they can have a medical home with a healthcare provider that can render their care. So I guess the question also, we have to think about the connection between healthcare and the judicial system, right? If people who are being charged before they're even get access to healthcare, and then those people who are in jails and in prison cannot get access to healthcare, and then once they get out, they're being asked about their previous incarceration that then also affects their ability to access healthcare. Having a patient navigation system can only do so much, right? And so I don't know. That's a comment/question.
Conversation, there has been a focus on the police. So I think in this whole conversation, we talk about, these police reallocation of funds and the whole thing. But I think that people lose sight that the criminal justice system, the police are just a part of it. And I think that we have to be this train from the DA's office associated with the police way to the judges who sit on the bench who want to be involved in social worker kind of activities. They're a breed of judges who believe that they're just supposed to be here to issue fines and to get crime underway and to do those kinds of things, and don't think that a judiciary calls for that kind of response. So there are trains of thought that need to be thought through in this whole process. Is there a connection between public health and the judiciary? Of course there is, but there has to be an understanding and a caring among judges to realize that this person needs extra help. Our police department works with a dual diagnosis program, and through that program, we have people everybody that gets arrested basically has a dual. If you got a substance abuse problem, you probably got some other diagnosis, PTSD, ADHD, bipolar disorder, schizophrenia. And somebody needs to be able to send persons to places where they can get help with this. But as long as the police is what it is, as long as the mindset of the DA is what it is, as long as the mindset of the judge is what it is, we're never, ever going to get to that place where we will utilize those services, because everybody thinks that they are, quote unquote, the law and order judge, the law and order cop, the law and order DA. And until we can kind of eradicate that, we can have all the services that we need, but we have to let this mindset be that this is brother's keeper on every level. And justice, no, it's not blind. Whoever just put that up, it's not blind at all. It can see well, and it sees what it wants to see. You know, the last election was about the courts. Donald Trump has done an excellent job of stacking the courts. Stacking the federal courts, he has stacked them to the hill. The Supreme Court, it doesn't matter. And what happens from this point, he has the majority that he needs. Thank God John Roberts is swinging sort of the other way and becoming a moderate, more conservative. But by the same token, the court almost lost that whole chance. So now we have to make sure that we are putting judges and people and DAs and public defenders and people in places where they can change the narrative. That's why you got to vote. That's why you got to vote. That's why you got to read up on the people that you're voting for DA in your district, for attorney general, for the district court judge, for the superior court judge, because if you don't, we'll never get out of this whole continuum. Yeah, there should be an association between the judiciary and public health and all other health entities. But as long as we have judges who believe that social work is for social workers and they don't want to be social workers, that they want to be law and order people that gets the votes from the community that's afraid, we're going to always be in this position.
We're about 15 minutes to close. So I just want to move on to the last, I guess, topic. A lot of it we've already covered, but one thing that we haven't really discussed is this call for 8 reforms that can't wait. And I saw Deidre also shared this 8 steps to abolition. What are we doing now to address these calls for 8 reforms and or steps to abolition? What are we doing?
Well, I can speak to this a little bit. I mean, on the statewide level, we are asking, we are looking at these 8 policies that law enforcement agencies can take up that would mean less violence in our communities. And I'll tell you that some departments have several of them, some have very few of them, but there is uniform kind of resistance to these, which again makes the conversation about resources, all the more important. It would be different if we were dealing with a police state that was that acknowledged the problem on a systemic and holistic level, but that ain't where we are. Where we are, even kudos to our North Carolina Sheriff's Association, who wrote a letter essentially disavowing what happened to North Carolinian George Floyd in Minneapolis, Minnesota. Right, that was beyond groundbreaking. That the North Carolina Sheriff's Association would say what this officer did was wrong, and this is not what we should be about. We have to rethink a lot of things in response to this, but we want to be really clear from our association standpoint that this is wrong. But there are hundreds of officer-involved shootings every year, police brutality, misuse of force, where, maybe there are some of the deputy chiefs who might say in a space like this that thing is wrong. But by and large, you don't see officers saying, this ain't who we are. Like, this is not what we're about. We need to do something different. And that has to change. The law enforcement wants community trust and kind of partnership, but the law enforcement has to do its part. And government, we got to do our part. Like, you got to say to us, I saw somebody in the chain ask a question earlier. Jeremy's talking about what the governor is doing and all these different things. Like, name a program that they have been a part of. We do partner with the community-based agencies that deliver services, our community action agencies. We are partnering with communities to do work around HIV and delivery of service to minority communities. We partner with My Brother's Keeper. We partner with our Divine Nine communities to do voter outreach. We partner with communities through the Office of Public Engagement that are community led. If a community says that they need something, we want to be there to partner with it from the governor's office perch. But we can't just be in government and law enforcement and the delivery of any state or local service. We cannot be just pointing to communities and saying, trust us, like give us your money, let us do what you want to do. Like we have to earn that trust, and we ought to be proactive and thoughtful in the way that we're delivering that service. Otherwise, there's no reason for people to lean in and trust us.
I also want to hear from Assistant Chief William Penn. What is the local police department doing?
Thank you. Well, as far as Winston-Salem, which is really who I can speak to, we've been the 8 Can't Wait, we've been in compliance with for years. And with that said, I can't argue with what a lot of folks are saying about what departments across the nation have been doing and the cultures, and I can't, and I wouldn't even if I could, but what I will say is that over time and with the right leadership, I am comfortable speaking the way I can, and I can say that this is wrong, that's not right, and move towards a more equitable department. But that leadership comes at the local level and pushing, and I'm not even supposed to be talking about endorsements, so I'm not talking about anybody in particular, but making sure that the folks who have their fingers on the purse strings of the police department hear from the community about where they want that money spent. I think the community has a lot more power than they think they do when it comes to that sort of thing. No, not necessarily arguing with a police officer on the side of the road, but every couple of years, here comes that voting day, and that's when you make the decisions. And city council does have say in how much we get and how we spend our money. So what I would like to do is just encourage and ask the community to engage. How do you want to be policed? I know some people don't want the police at all, and I get that. And you know, we all here with an opinion. However, I do think that there's power in discussion, and I know people get tired of talking, but the election day is when you've done all your talking, you've done all your listening, and now it's time to take that action.
Speaking of elections and elected officials, we have a special guest, State Senator Derwin Montgomery, who has joined the call. Just want to give you an opportunity to have some words.
First and foremost, thank you all, and apologize even time I wasn't able to listen into all of the conversation dialogue as I literally just left the House floor. We are in a long day of session and work here. Unfortunately, the fact is that we're not taking up and addressing many of the legislative opportunities that have been discussed here and actions that we can take at the state level to help address much of what is being discussed and what community members are crying out for and asking for in this moment. And for me, as someone who has served in local government and now at the state level, I will agree with the last commentary that all politics are local. Tip O'Neill said it, and I agree with it, and I believe it's true that we have to, one, make sure that local elected officials are held accountable, but then also as a community, I believe that we have to give space for elected officials to do the necessary work. And what I mean by that is that sometimes what I've seen in elected officials, they get so caught up in the process of getting elected that they take expedience. What can we do really quickly instead of what can we do that's meaningful? Because it is the thought that unless I give the people something very quickly, I'm not going to be able to get elected to work on the longstanding issues that are out there. And some of that may be true, but often what happens is you never get to the real nitty gritty of what folks are looking for. And when I think about policing, when I think about the current atmosphere that we stand in this moment today, I sincerely believe that we have to come and have a real dialogue in reference to the challenges that we face around policing, and not the sense that we need to. I'm not one that joins in and says we need to abolish the police departments, but I do believe that for too long, police have been the solution for every community problem. So as a council member, if there was a question that came to me, and I own my guilt in that process as a policymaker, that if a person came and they argued that they felt unsafe or there were challenges in the neighborhood and the community, the quick, easy solution was, well, let's figure out how to get more police in a neighborhood, rather than how do we really get the resources necessary to deal with root causes in neighborhoods and communities. And that's the part of the problem solving that we need our policymakers to rest in and have the courage and will to do so. And I think that as we begin to have those conversations, I think we'll start to see some of the some of the results that I believe folks on today and others in community are demanding, and past time for our communities to see come to fruition.
We certainly appreciate all of the panelists for being able to join today. I want to just wrap up by allowing the panelists to provide briefly, 30 seconds or less, some information about how the people who have joined the call and who are watching can contact you or find out more information about the work that you're doing.
For me, you can reach out to our office by phone, 336-245-1088. You can follow us online, Facebook, Derwin L. Montgomery, and send a message there to be able to, if you have questions, comments, or concerns that you like for our office to address, or policy issues that you think should be engaged, feel free to shoot an email or message there online. And also email, which is derwin.montgomery@ncleg.net.
Hey, so from my perspective, we have a dedicated website for folks to engage with our office, governor.nc.gov/engagement. You can go to that website and kind of sign up for information that you'd like to know about. You can also visit our website, governor.nc.gov, and go to contact, and you can send us information about any number of things that you'd like to see us take action on, request a meeting, and so on and so forth. But if there are specific issues in your communities that you'd like for us to take on, or to connect you with the appropriate resource, that's where you can do that. And then if you just want to kind of share your thoughts about things that we can do and what we ought to be doing, I welcome you to do that. We have a portal for that as well. You can email my office at ope@nc.gov. That email address is ope@nc.gov. And there you can kind of tell us, hey, you guys are getting it all wrong. We ought to be doing this, or I agree with the governor and what he's doing. But our job is to be liaisons with community leaders, and we don't take that lightly. We're excited to be in this space, but we're also we're excited about being doers of good work. So thank y'all for the opportunity.
Thank you, Dr. Jack Monell.
Sheesh, 30 seconds or less for a professor. Okay. All right. First and foremost, thank all of you, all of the panelists. Thank Dr. Mathews, the Maya Angelou Center, and thank all of you. If you want to follow me, you can find me at any one of these protests. So no, all jokes aside, everyone protests differently, right? Use your gifts. So use your great gifts. I'm on Twitter, Jack Monell, JCKMONE. LinkedIn, Jack Monell, MONEL. Instagram, if you're on Instagram, Project Kid WPHD. And you will find much of the work I do, both research, through activism, and some of my other shenanigans. Because, we're human, right? But most importantly, I will say this: nothing brings me great pride and joy than being able to be out there on the front lines with the young people who have been the focal point of this revolution of ours. So to all the young people listening, listen, keep doing it, keep fighting, keep keeping that pressure on them, because we have to keep it we can't let go. We got to keep pushing for that for that equality, and that equity that we oftentimes lack in our society. Y'all take care, man. Thank you.
Thank you so much, Judge Denise Hartsfield.
I am available for everyone who has an interest in young people, part of our juvenile system in Forsyth County. Our juvenile justice system is imperfect like the rest of the criminal justice system. However, I have found through long studies and trial and tribulations that mentorship is still a very strong key to this whole organizational structure that we call juvenile justice. School justice partnership is something that I encourage people to come and help and talk about as we prepare for a new school year like we've never seen before. What are we going to do about kids in school and the police in school? And also, in my work at Wake Forest University School of Law, I'm always looking for new pro bono activities to get students engaged and people to go out and help in this community. We can do expungements, we can know your rights, a brake light clinic, because we know most people get stopped for the brake light being out. So we've been putting in free brake lights to keep people from having to come to court. And I would love to hear, and I would love to partner Dr. Monell with Winston-Salem State and some of these activities. So I'm looking for community building. I can be reached at Denise.Hartsfield at nccourt.org. I can't talk about your case, and I can't talk about criminal matters, but I certainly talk about collaborative and ways that you can work. Mr. Penn is doing a great job in helping with all kinds of things. But Dr. Monell, I would love to have some partnership between the students at the law school and Winston-Salem State to talk about how we, as the young people that you talk about, can help solve many of these issues from a pro bono perspective. Thank you.
Well, Judge Hartsfield, I know how to reach you, so we will address that. And secondly, I also serve on the Juvenile Crime Prevention Council here at Winston Court. So you and I will definitely talk some more, ma'am.
JCPC, I think I'm going to take Judge Hutchins' spot. So more of it. All right.
Okay, great.
Enjoy.
Okay, great.
All right. 30 seconds or less, Ms. Deidre Jackson. How do we contact?
Yes, I am dropping my organization's website into the chat. If folks want to know more information about BYP 100, we have 10 chapters across the country. It's a national organization. Anybody that's Black can join. And if you want to learn more about some of the work that we're doing in Durham, you can visit durhambeyondpolicing.org to get updates on how that work is moving. Feel free to donate and share, reallocate your resources to young Black organizing that's happening right now.
Wonderful. Dr. Elimarie Caballero Quinones.
Thank you so much for this wonderful opportunity. I really enjoy a lot to have, all these conversations and thinking about different topics. You can find me in the Wake Forest website, also Instagram or on LinkedIn, Elimarie Caballero, Dr. Elimarie Caballero, and you can send me a message if you want to collaborate or anything. Or if you have any patient in Wake Forest, remember that I'm there. Let's move on. Thank you.
Last but not least, Mr. William Penn.
Thank you for having me. It really was an enjoyable experience. My email is wpen@wspd.org. You can visit the department's website, www.wspd.org. I welcome conversation. I told you about the action you can take. However, I'm adamant with everyone. I'm adamant that we can find some common ground, at least to begin a conversation. Even if we don't agree with how to get there, I think we all basically have the same place we want to be, which is safe and equitable protection and service from the police departments.
And lastly, you all can follow the Maya Angelou Center for Health Equity on Facebook, WFMACHE. We call it MACHE. You can also follow us on Twitter, FSOMMACHE. So thank you all again for joining this conversation. We will be working to continue these conversations and host these on Facebook, Twitter, and YouTube, calling them MACHE Mondays. So we're trying to feature important conversations with community leaders to push the agenda forward towards health equity. Thank you and have a good evening.